Hello, Danny Blyth here, looking at the lung in Chinese medicine, and especially we're going to look at the difference between what we think of as the lung in Chinese medicine and the lung in Western medicine, what we normally think of as the lung, and the differences between them. Please pause and read this. Remember, this is for acupuncture students only. The big difference is that the lung in Chinese medicine represents the whole respiratory tract. So from the nose, problems with the nose, the nasal cavity and the mucosa, the sinuses and problems with the sinuses, the pharynx, into the voice box, problems with the voice, the lower respiratory tract, so the trachea, the bronchs, the bronchioles, the alveoli, so lung conditions, asthma, weak chest, all of this falls under the remit of the lungs. Not only that, but the lung also represents the exterior, and this means two things. First of all, the skin, the mucous membranes, so the mucous membranes of the eyes, the nasal cavities, where pathogens first invade. They're kind of outside, and we think of the paired organ being the large intestine. And the exterior is the immune system, not only the skin where the barrier immunity is, but also dispersal of Wei Qi happens through the skin and protects us from infections and pathogens. The lungs also have a role in the Zheng Qi, the upright Qi, and dispersal of fluids. So our lymphatic system, along with the spleen, the lymphatic system and mucous membranes are under the control of the lungs. So invasions affect the exterior when we get a head cold or we get an infection of that kind. So if we think of the lungs from most superficial to deep, a viral skin rash, a head cold, sinusitis, laryngitis, tracheitis, bronchitis, pleurisy, pneumonia, asthma would all be aspects of the lung in Chinese medicine going from superficial to deep. So the lungs are considered the delicate organ for this reason. The lungs make up part of the circulatory system. So we have the beating of the heart and the circulation, and we have the pulsing of the breath and respiration, and together they make up in Chinese medicine the zong qi, the qi that controls the strength of our voice, circulation and peripheral circulation, and our general energy levels. So if these things are adversely affected, we may be treating the lungs. Finally, the lungs are connected to the Po, or the corporeal spirit. This is our connection on a spirit level to our physical bodies. The emotion associated is grief or loss, which is said to dissolve the qi and affect the lungs. We see this with the immune system being affected by grief, for example. The Po connects us to our physical bodies, so being comfortable in our skin, being happy in our own skin, with our physicality is to do with the Po. Bodily sensations like touch, and the primitive instincts, the sort of instincts we have as babies, and flinch instincts and things like that, are to do with the Po. And smell and body memory. So if you think of how when you smell something, you can be instantly transported back to a really visceral memory in a way that remembering it with your visual side of your brain doesn't have the same effect. This is to do with the Po. If we do the reverse and look at some of these organs in Western medicine and think of their connection to the Chinese medicine idea of lungs, in Western medicine the lungs are to do with the gaseous exchange, the extraction of oxygen, transfer into the blood, release of carbon dioxide, and maintaining the pH by balancing carbon dioxide. So this is very much the lung in Chinese medicine. Speech in Western medicine has to do with the force of air from the lungs, the sound of the folds in the larynx and the voice box, and the shape of our lips, pharynx, oral cavity all make up the speech. So all of these things are to do with the lung in Chinese medicine. The skin in Western medicine forms the barrier aspect of our immune system and also maintains the fluids through waterproofing and sweating, and regulates the temperature via sweating. So this is the same in Chinese medicine. The qi men, the gates of the qi, control our temperature and sweating. And sensations, so all the nerves of pain, touch, pressure, temperature in the skin, similar to the relationship to the Po in Chinese medicine. The immune system in Western medicine is complicated. The barrier system is the skin and the mucous membranes. The innate system is our quick-acting first responders and leukocytes, and then acquired immunity is the slower acting. If we think of the organs of the immune system in Western medicine, the tonsils, the mucous membranes, the skin would be the lung in Chinese medicine. The lymph glands, the lymph itself, the appendix, the spleen would relate to both the lung and the spleen in Chinese medicine, and the thymus and the bone marrow would relate to the kidneys in Chinese medicine. Thanks for listening.